Hi everybody, we're going to wrap up this chapter on the skeletal system with information coming from how to heal a bone fracture and wound healing. That information comes from 71 in your course pack. We're going to first talk about different types of fractures. Open fractures and closed fractures. So let's discuss those first. Open fractures may sometimes be called compound fractures. In this kind of situation, we see that bone can poke through the skin, like you see here on the far right. Okay, so that produces an opportunity for an infection because now you've got bone exposed to the environment. Bone infection is called osteomyelitis. Closed fractures are called simple fractures. Well, they're simple in the aspect that they haven't had a bone poke through the skin, and that means that the bone is in place inside the body. That doesn't mean it's any less complicated, it just simply means that it is not poking through the skin. You can see in this image here, they're showing us a picture of osteomyelitis in this particular bone. It must have had an infection, perhaps by being an open fracture in which the bone poked or protruded through the skin. The problem with osteomyelitis is infection can affect not only the bone, but also surrounding tissues like muscle tissues or connective tissues. Let's talk about ways to heal a fracture. Fractures may be set and repaired by closed reduction, which means that the bones are manually put back together. Or bones may be set by what's called open reduction. And again, here the bone is exposed and may be set with pins. Let's talk about bone healing and the time to heal. Bones are a fast repairing type of tissue. They are highly vascularized, and it's important for them to be able to regain their role as a support structure in our bodies. So the time to heal here is around 6 to 8 weeks in length, and it may be longer for the elderly. When a bone is broken or fractured, the first thing to happen is a blood clot will form. That blood clot is called a hematoma. The hematoma allows for new healing agents to come into the area, and also at this time we start to see white blood cells move in to remove some of the dead tissue. The next step is the fibrocartilage callus formation. Fibrocartilage is going to form a scaffolding, you might say, upon which the new bony tissue will be built. So fibrocartilage creates a bridge over that broken area. Blood vessels grow into the area and start bringing in new bone supplies, such as calcium, to regrow that bone. When the bony callus is formed in step 3, we see that fibrocartilage is now replaced by spongy bone tissue. Osteoblasts may move into the area. They'll help to deposit new bone tissue, while osteoclasts may start to remodel that tissue or remove bone from that area. And that is step 4, bone remodeling. Involves the use of the bony callus with osteoclast and blast. It may not be as nice as it was before. You may in fact see a healed fracture through an x-ray or just by visually examining that bone. When the remodeling is complete, both fibrocartilage callus and bony calluses should be gone. Let's talk about different types of fractures. Let's talk first about the greenstick fracture. Greenstick fracture involves young bone because it's not completely and fully calcified yet. So this is an incomplete bone break because it's not a full break through the width of the bone. So children often experience this type of break because their bones are not fully set with calcium. Compression fractures are next. This is a picture of a compression fracture. You can see here that the bone is compressed literally between the two intervertebral discs. So osteoporosis, where the bone becomes brittle and more porous, is commonly the cause for compression fractures. This is a depressed fracture, which may occur if someone's hit in the head, for instance, by a baseball or a bat even, and this depression fracture pushes the bone in toward the organ underneath. Another look here at a depression fracture back here toward the back part of the skull. Spiral fractures occur in which there is a twist. You can see a diagonal twist right through there. That is our spiral fracture. This may occur in a sports injury or where someone has, twisted their arm. In some abuse cases, we can also see spiral fractures because of the twist of the arm as someone is trying to escape, perhaps being held. So let's take a look at this comminuted fracture. It is a complex fracture because it involves multiple breaks, typically in 3 or more places. Here you can see a broken fibula and a broken tibia here. And of course, if there's many breaks like this, it may involve open reduction, in which surgery must occur to set these bones back. Now, this last bit of information is just for your information. It is not in the course pack and it's not on the test. I thought you would be interested in hearing about compartment syndrome. When a broken bone occurs, the surrounding tissues may also be inflamed. We know that inflammation results in red, hot, swollen, or painful tissues. It is the swelling that's the issue here. There are compartments of fascia made up of connective tissues like loose areolar connective tissue that separates one muscle compartment from another. If swelling occurs in one compartment, it can put pressure on the entire area, such as in a leg. So, unfortunately, if this occurs, draining the fluids out of that area may be the best solution for reducing compartment syndrome. So here they call it a fasciotomy. That helps to provide relief from compartment syndrome when swelling may occur due to a broken bone.